Hi there, this is Ben with HCO Thrive. Today I wanted to do a healthcare provider news roundup for January and the new year. I intend to start doing these every few weeks or probably a minimum at least once a month, and then also discuss other news articles as they come up with more brief videos. Specifically, we're going to cover hospitals and the overall healthcare system, then drill down further into skilled nursing facilities and then home health agencies. Among the news articles we're going to review, I've identified a bunch of general themes that seem to run through them all. Quite a few of these are surveys examining providers' outlook for 2026 and beyond. Some are projections, and then others are about current events. But regardless, many of them deal with environmental pressures like regulation and changing demand. A common theme among surveys and news articles was retention of workforce within the long-term care community post-acute. And then finally, there is CMS's continued emphasis on fraud, particularly among home health and hospice. First article I want to discuss is a McKinsey report, What to Expect in Healthcare in 2026 and Beyond. Again, just to emphasize, I want to make sure you know that all sources will be in the description below, so you can go find these at your leisure if you're interested. This is the article, but just to summarize it, in terms of general acute hospitals, EBITDA margins are estimated to grow from 6.8% in 2024 to 7.6% by 2029. In the short term, however, they project that hospitals will face headwinds from the impact of tariffs, subsidy expiration, and changes in federal policy. Moreover, hospitals' share of overall provider profits expected to decline from 41% in 2019 to about 38% by 2029. Decline will result in shift in care towards lower cost freestanding sites. Hospitals will likely seek above average reimbursement rate increases from payers as a counter to that. Now looking at the post-acute care segment or long-term care, they project continued growth in home health and hospice, but stagnation in skilled nursing facilities. For home health agencies, EBITDA is estimated to expand at 6% annually from 2024 to 2029. This will be due to care transitions to lower costs, patient preferred home settings supported by aging demographics and increasing membership in Medicare Advantage. On the other hand, EBITDA margin expansion will remain constrained due to CMS reimbursement pressure. More specifically, hospice is expected to see overall stronger growth of 9% annually, 2024 to 2029. Again, this is driven by rising Medicare enrollment, greater awareness of hospice benefits post-pandemic, and supportive policy environment emphasizing quality and transparency. EBITDA margins are likely to remain stable given provider rate dynamics. Skilled nursing facilities face structural challenges as payers direct patients towards shorter stays and home recovery, resulting in flat revenue and sustained pressure from higher labor and compliance costs, limiting EBITDA margin improvement. So obviously McKinsey has that brand recognition, so when they make a report like this, people tend to take notice, but let me know what you think, what your thoughts are on that. I'd be interested to know. The next article comes from Becker's Payer Issues, and this is an overview of the quote-unquote great healthcare plan. So if you're interested in this article, it's over at Becker's Hospital News. But now returning, it's really three different components. The first is drug pricing. They want to formalize the administration's most favored nation pricing model, which ties U.S. drug costs to the lowest paid by peer nations and preserves recent HHS and CMS agreements with drug makers. Next is insurance costs. The plan wants to eliminate direct ACA subsidies, whatever's left of them, to insurers in favor of sending sending funds directly to eligible Americans to purchase their own coverage. The second part of this really is kind of what people are saying about this plan, if you call it that, as a whole, that it's very, very short on details and specifics. So it's pretty hard to evaluate. And finally, price transparency. CMS, this has been a big issue for CMS in the last few years, and they're going to continue to try and harp on this and make sure that providers actually follow through and post their prices in a place where it's easy to see for customers. And the final article I chose to round out the hospital and systems section is about rural hospitals and how they plan to use the transformation funds if and when they arrive. This is also from Becker's in case you're interested. And I just pulled out a quote that seems to summarize this pretty well. Across interviews, a consistent picture emerges. Rural hospitals are prioritizing workforce stabilization, access to specialty and maternal care, technology and data infrastructure, and regional partnerships with an emphasis on investments with an enduring impact. Moving on to skilled nursing facilities, we have McKnight's Long-Term Care News 2026 Outlook Survey. Just take a look at it. And you can see they've broken it up into 4 parts. Across those 4 parts, I really just tried to pull what was relevant or what I found interesting and then kind of condense it. So just be aware of that. This was conducted by email, late November, early December, with more than 550 C-suite executives, administrators, and nurse leaders. One of the top issues, pretty much across all different respondents, was workforce concerns. Workforce matters continue to be a serious challenge for providers. More than 3/4, 76% of respondents cited it as one of their top 4 concerns for 2026. That's up from 70% a year earlier. This is particularly strong among nurse leaders, with about 79% choosing the CNA and RN categories as the top workforce worries. Unsurprisingly, another issue is regulatory uncertainty. Providers also frequently pointed to general uncertainty about payment rates and regulation, specifically reduced communication or inconsistent messaging from the federal government. I believe this is specifically in reference to some of the changes going on in terms of new data validation issues, the frequency of inspections as well, and just the plan going forward. And finally, there was also an emphasis on looking at new opportunities, in particular trying to recruit medically complex patients, add specialty services, and try risk-based payment ventures that pay for performance. So roughly 30% of skilled nursing administrators and C-suite leaders said they would be involved in major transactions next year. That's buying or selling nursing homes. So this may be because of the uncertainty or in spite of it, but there's an interest in, still an interest in expansion, as well as there is an interest in making changes and trying to optimize case mix. If you're a skilled nursing home provider, do any of these hold true for you? Let us know below. Next up is another article from McKnight's Long-Term Care, and it's that CMS reduces survey expectations to account for government shutdown. In short, it's going to reduce goals around some nursing home survey and certification standards by about 20%. And so even though this may seem like less of a regulatory burden, some providers are not all that thrilled about it because it can make recertification more difficult if they've had issues in the past. So many states still struggle to adequately perform routine and annual surveys. Recently, especially with the change in administration, CMS wants to concentrate more on complaints as opposed to the annual surveys. Complaints, though, contributed to 38 states failing to meet required recertification goals in 2024, and it also led to missed performance standards in 2023. One thing to be aware of, though, is that I believe CMS, via memo, said that they're going to take off in progress or pending complaints from Nursing Home Compare, but that they're still trying to decide what information they're going to present. So that's just one thing to keep in mind as well. And the final skilled nursing facility article I chose was also from McKnight's, And I thought it was interesting just that it expresses concern over whether or not providers are going to be able to meet the technical requirements of data validation. So specifically, with the change from QIES to IQIES, CMS is going to start auditing providers up to 1,500 annually, and they're going to seek the medical records of 10 patients. If a provider fails to do that, they could be assessed a 2% penalty. The gist of the article is that, though, the provider is going to have to collect the patient information, combine it into PDF form, and then send it to CMS. So I don't know if this is really a valid concern or not. I imagine most providers should be able to handle this, but the article doesn't. So let me know what you think, if this is going to be an issue or not. Moving to home health agencies, we have another survey by AccessCare of more than 300 home care respondents. And basically, they were concerned with client affordability, rising costs of staff, supplies, and services. And we can take a look again from Ignites. And here you can see caregiver shortage, caregiver recruiting, caregiver retention, profitability, revenue growth, and so forth. Pretty much what you might expect. The next article from Ignites is about home health hospice leaders meeting with CMS's Oz, Dr. Mehmet Oz, to address fraud concerns. So fraud has typically been tied to a bunch of geographic hotspots, specifically Arizona, California, Nevada, and Texas. However, Medicare is going to be taking a closer look at new agencies in Ohio and Georgia as well. The result of the meeting, though, was a series of recommendations, which include provide additional documentation at the time of enrollment, using a targeted risk-based approach to prioritize oversight of providers that exhibit aberrant billing patterns, better leveraging regulatory and enforcement tools to prevent problematic providers from persisting in the Medicare program, and enhancing public reporting to improve system-wide accountability and transparency. So again, I believe there's a current concern with hospice and home health in Los Angeles County. A lot of these concerns are around new providers that allegedly don't really provide any care. Sort of similar to situation with daycare in Minnesota. So generally, more oversight, more regulations, providers might balk at that. But in this case, many are applauding it because it will help weed out the fraudulent activities. And then that way, that won't impact potential reimbursement rates going forward. So I would say on the whole, many providers do approve of CMS's focus on fraud, specifically with respect to home health and hospice. And our final article from Ignites Home Care is based on an industry report where personal care turnover hits 126% as home health referrals rise. And specifically, this comes from WellSky's 2025 Evolution of Care report, with them reporting for many providers, nearly 80% of employees leaving within 100 days. So that's just over 3 months. That's pretty bad. And of course, this churn threatens agencies' ability to keep pace with demand, which is constantly growing. Referral volumes are climbing, and as well, patient complexity is also rising. And that will do it for our mid-January 2026 news roundup. Please let us know if you have any feedback, comments, concerns. Let us know if this was helpful, if this was interesting. We plan on releasing a bunch more videos in the near future, dealing with more news reports as well as technical reports and data-driven reports, especially with the Quality Compare refresh coming at the end of the month, as well as the recent refresh of the financial data through HCRIS. So that really concludes it. Thank you for watching.